we can think of healthcare protection gaps in emerging markets as the sum of two parts. The first part is out-of-pocket spending that causes financial pain, that causes financial stress to households. The second part is incidences of non-treatment due to financial constraints because people cannot afford it. This is a very simple, intuitively appealing way of looking at the healthcare protection gap. However, it presents a few challenges or shortcomings. For example, this definition is unable to capture a very relevant aspect of the protection gap, which is a lack of access. Lack of access to medical services, which is the biggest challenge, especially in the poorest countries of the world. A second challenge is about sustainability. Public schemes, government schemes are reaching their limits. So it is very likely that households going forward will have to carry a bigger share of the financial burden. And this shift in burden is nowhere reflected in today's estimates and projections of the healthcare protection gap. So this suggests that we are very likely to underestimate the future scale of the problem. Swiss Re recently came up with an estimate of the health protection gap in emerging Asia. They put the number at 1.4 trillion US dollars, which is about 8% of the region's combined GDP. So this is the total maximum possible shortfall, funding shortfall. So the amount of money needed to eliminate any financial stress from out-of-pocket spending, plus to pay for the treatment of those who cannot afford it. Now, at the Geneva Association, we have tried to break this number further down to an annualized sort of funding shortfall to make it more palatable. And we have done so based on data from the World Health Organization, out-of-pocket spending data from the World Health Organization, and also based on a few very simple assumptions. We have assumed, for example, that in the poorest countries of the world, all out-of-pocket spending is stressful by definition. Whereas in the so-called upper middle income countries, so the wealthier emerging markets, just 50% of out-of-pocket spending is financially stressful. And based on this methodology, we came up with an estimated annual protection gap for all emerging markets of around 300 billion US dollars, which is 1% of GDP, year after year. So this is an annual figure, 1% of GDP. And this, by the way, is more than 3 times the level that we observe for the natural catastrophe protection gap. So there is no doubt that the health protection shortfall is of utmost relevance to emerging markets economies, to societies, and that it warrants very urgent policy action and attention.